Here are a few guidelines for some regular medical questions that pop up from time to time. If your child suddenly develops any illness, a cold or flu or any other illness of note, the Department of Social Development stipulates a few guidelines. If the child is placed in your safety care, then the child should go to a government clinic for whatever illness the child has. And if the child is in your foster care, then the child can go to the government clinic or to your own private GP. If there are any chronic illnesses involved, then the child obviously needs regular checkups every 3 to 4 months or every 6 months, whereby the child will get a regular medical examination, some blood work will need to be done, medication adjustments that should be done, and again, it depends on whether the child is placed in safety care or in foster care. It's advisable that the social worker should always be informed anyway whenever you go for any medical doctor's visits, just so that they can keep a track of what's been happening in the child's life. If there is a medical procedure that needs to take place, and it's an elective procedure, then contact your social worker, because she will have to contact the biological parents to obtain the necessary written consent. If, however, it is an emergency procedure, then the surgeon and the superintendent of the hospital will give the necessary consent for the procedure. And then if you're wondering about medical aid and whether they will cover it, it depends from medical aid to medical aid, so the best is just to contact them, but most medical aids nowadays do allow foster children to be placed as additional dependents on your medical aid, as long as the child has got the South African identity number and you as the foster parent is obviously willing to pay the additional amount.